Perfect. All right. Well, thank you, Monica. And I'm so grateful to the Olympia Co-op for hosting these classes. I think it's such a wonderful offering to the community. And I love to teach. And so I hope you find this useful. Please do ask questions along the way. You are welcome to unmute yourself and just ask, or you can use the chat, and I'll be keeping an eye on that and trying to answer questions as we go. I'm Dr. Jennea Wood. I'm a naturopathic physician with Tummy Temple, and I love treating asthma, allergies, and eczema. I treat a lot of them. Um, and there are just so many ways that we can help our bodies um, have less of these types of conditions and reactions. So let's get into it. Okay, so take-home messages I want to leave you with today are um, all three of these conditions. They're different conditions, but they have a lot of crossover and similarities. So, the kind of root causes we're going to be talking about today apply to all three. They have a component of genetics. So some people are genetically more susceptible, but then there's this major component of our environment and what we're exposed to. The basics are really crucial. So, what you eat, how efficiently and thoroughly you are able to digest your foods, elimination, like pooping regularly, sweating, staying hydrated, urinating, all of that is really important. Stress is really important. Sleep is really important. So, the basics can make a big difference here. Um, and we're going to cover kind of a lot of different factors. It's important to know, it's not about perfection. You don't have to do every single one of these things. You don't have to do them all at once. So just, see what kind of works for where you're at. And a lot of this is it should be really individualized. So not every one of these things will apply in the same way to every person. And so, just jot down notes if there are things that jump out at you oh, that really makes sense in my case. All right, so the concept of hay fever did not really even exist until the 1800s. So allergies were just not really a problem until urbanization and industrialization. Um, and then, with the advent of antibiotics as well. So people lost contact with soil, with farm animals. They were exposed to more air pollution, water pollution. And then once the overuse of antibiotics began, that started to really alter people's microbiomes in a way that worsened these conditions as well. Um, there's been an additional and significant increase in the number of people with allergic conditions with the overuse of antibiotics, especially during childhood, and we'll talk about that in a bit more detail later on. So, why is this happening? There's this interaction between three facets of our environment. So we have, the outdoor environment, which would be pollution, pollen, and then the indoor environment, toxicants and dust mites in our homes, and then our internal environment, our microbiome and gut lining. So to go into a bit more detail, our outdoor environment, the things that are having an impact here are pollution from cars and industry, and those chemicals and uh, air pollution, particulate damages the respiratory lining in the lungs, in the nasal passages, sinuses, etc., and also overwhelms our body's ability to detoxify them. And so these things can somewhat accumulate in the body. Rising carbon dioxide levels in our environment also actually increase the growth of weeds and allergenic plants and actually make them more allergenic. And then um, pollen itself does act as sort of an inflammatory irritant, and it also does some damage to the lining of the respiratory tract. And then the body, so there's this like irritant piece, um, but then the body can sometimes recognize pollen or other compounds as an invader and mount an immune reaction to it as opposed to having sort of a tolerance reaction to it. And then finally, this is something I actually only became aware of in the last few years. Many cities have switched over the last 50 or 60 years from planting about equal numbers, 50-50, of male trees and female trees as just, the city trees. Male trees produce pollen, female trees produce seeds. Um, However, over the past 50 to 60 years, most cities have switched to planting exclusively male trees because they don't want to clean up the seeds that fall all over the ground. And so that has actually resulted in a huge increase in pollen during spring in cities, which coincides with a 70% increase in allergies. Not to mention, all that increased pollen actually causes hormone imbalances as well. It has other effects on the body. So, moving on to our indoor environment, we have just countless chemicals that can be floating around in our homes from cleaning products, makeup, body care, skincare, etc. And many of those, that industry is so poorly regulated, they're just, almost allowed to put anything in those formulas, and many of them damage the lining cells of our body, so the lungs, sinuses, etc., and actually disable local immune responses, make them very dysfunctional. And it's another thing that our bodies need to detoxify and just kind of overwhelms the capacity for detoxification. And then those chemicals also can act as allergens, where the body recognizes them as an invader and produces histamine. Um, and then finally, dust mites. I mean, that's been a factor forever. That's not a new thing with the Industrial Revolution or anything like that. But they, along with all of these other factors, they're just kind of still there, causing problems. So dust mites themselves can be toxic and also spark an allergic reaction. And then finally, in this part of the world, we have more of a propensity for mold to grow, and that can cause allergic reactions as well. So moving on to our internal environment, the biggest factor that has influenced this has been the overuse of antibiotics. So antibiotics can be absolutely life-saving when they are truly needed, such as in a dangerous bacterial infection. So I am not saying never take antibiotics, they can save your life. But I do think that they are massively overused and they get used for things that they aren't effective for, such as viral illnesses, and many or most ear infections are viral. Many or most sinus infections are viral. Many or most bronchitis infections are viral, and then colds and flus are viral as well. So even in conventional medicine, like I have a medical database that I will log into to check like what is the standard of care in conventional medicine for bronchitis. And it specifically says um, antibiotics should not be offered. That's not what most MDs do. I think partially out of habit and partially because um, so many people have been trained over decades that if they have bronchitis, they need antibiotics. And so they're also asking for it and pushing for it. And, it's not what's supposed to be done, but it is done all the time. And so that's one place where naturopathic medicine really shines because we have so many other tools that are effective for these types of viral infections um, to get people through them. Bronchitis can turn bacterial and then, can progress in some cases to pneumonia, and then it should absolutely be treated with antibiotics. But early on, oftentimes you can use all these other herbs and nutrients and even like hydrotherapy treatments to change the course of the illness so it doesn't go that direction and antibiotics are not needed. So studies show that especially early childhood use of antibiotics increases risk of asthma and allergies. And research done in Europe has shown that children who grow up on farms have a wider diversity of microbes in their gut and have a 70% reduced prevalence of allergies and asthma compared to children who didn't grow up on farms. So they are exposed to such a wide range of microbes, and that during immune development, so during those early years of childhood, um, allows the immune system to undergo a balanced maturation, to mature in a way that produces healthier and less allergic immune responses. So, um, catching people young is really, really important. Not that there aren't a ton of things we can do if that ship has sailed. So, getting a bit more into the foods that we eat in kind of the Western world, you know, there are a lot of things missing from the standard American diet, and then there are a lot of things there that shouldn't be. Um, I'm gonna assume that people finding this class through the Olympia Co-op probably are eating a lot healthier than your average American. But you know, sometimes there's room for improvement. So the things that are missing are most Americans are not getting enough fiber by a long shot. But even health conscious people, you know, I see people every single day who are generally pretty health conscious and are still not getting enough fiber. So that's one major thing. And then bioflavonoids, which are plant antioxidants. And the two things that we need to feed and sort of fertilize our healthy gut bacteria are fiber and bioflavonoids. So they're just crucial. And then another thing that's missing from the Western diet is just variety. So the more variety that we have in the foods that we eat, the more variety there will be in our microbiome. And it doesn't mean that you need large quantities of each of the types of foods. It can be um, small amounts of herbs and spices. It can be herbal teas. You don't have to have a lot of like a bulk amount of these things to make an impact and to diversify the microbiome. And then the Western diet is, you know, often deficient in vitamins and minerals as well. So what is there that shouldn't be? Too much refined sugar, additives and preservatives, too much salt, antibiotics in meats sometimes, pesticides, herbicides, and interestingly, glyphosate, found in non-organic vegetables, particularly fruits and vegetables, acts somewhat like an antibiotic. So it's like you're getting teeny tiny doses of an antibiotic, and then growth hormones. So taken all together, this results in nutrient deficiencies and just completely throws out of whack the growth of healthy bacteria, encourages the growth of inflammation-producing bacteria, and then just overall variety of the different microbes is lost. So what do we do about it? Um, and first, I just want to say, ask the question, well, why not just use over-the-counter antihistamines? And a lot of people do this, and so are sort of like, well, why bother? You know, that gets me through. Um, so one thing I want to touch on that I think is not known by a lot of people and is really, really important information is that some types of antihistamines, particularly Benadryl, um, it's an antihistamine, but it also has anticholinergic effects, and it's associated with an 8 times increased risk of dementia with regular use. So, like, just mind-boggling that that's not known by everybody. It should be shouted from the rooftops. That said, Benadryl is the preferred choice in an emergency allergic reaction. So I'm not saying don't use it in those situations. Like if someone's going into anaphylaxis or like got stung by a bee and is allergic to bees, take the Benadryl. I'm saying don't use it as your daily or even like regular thing for seasonal allergies. That is a very, very bad idea. And definitely don't use it as a sleep aid. It gets sold as a sleep aid all the time. Um, Other antihistamines, such as particularly Allegra and Zyrtec, are, and I believe Allegra, the generic is fexofenadine, and I am gonna blank on the generic name of Zyrtec, but it's easy to look up. Those two do not have the anticholinergic effect, and they do not have an increased risk of dementia associated with their use. So they can have other side effects. And then the other reason not to only rely on those options is that they're not addressing the underlying cause. So by looking at the underlying root cause and addressing that, you will become healthier overall. Allegra and Zyrtec are a Band-Aid and just aren't going to do that and might have other side effects. They can be constipating, they kind of dry you out. Definitely worth digging into root causes. So, the successful treatment of allergies, eczema, and asthma needs to include both decreasing exposure to the irritating or allergic substances and shifting the immune response away from an allergic type response. So, in the name of reducing immune triggers, things that you could do would be having a HEPA air purifier at a minimum in your bedroom, but ideally, a one, two or more around the house, depending on the size of the house. Having a HEPA vacuum and vacuuming regularly. And that the HEPA filter just, does a more thorough job and doesn't like sort of recirculate some of the allergens. Having dust mite covers for pillows, comforters, and mattresses, washing your linens weekly on hot, and then keeping windows closed during peak allergy seasons. And then on a internal level, eating an organic or mostly organic, nutrient-dense diet, aiming for 7 to 9 servings of vegetables and fruits per day. Increasing fiber, and so foods that are rich in fiber include beans, lentils, whole grains, vegetables, ground flax seeds, chia seeds. I recommend that most people add 1 to 3 teaspoons of chia and or ground flax to their foods daily, and potentially even working up to a tablespoon twice a day. So that would be 3 teaspoons and a tablespoon 2 times a day. Don't take it all at once. It can just be too much and it's hard to get enough water to balance that out. And if you're adding in extra fiber like that, you definitely need to be mindful of water and probably up your water intake a bit. Otherwise, it can be kind of backfire and be a bit constipating. And then also slowly working up to eating around a cup of beans or lentils per day. If you don't already eat a ton of fiber, go very slowly. So start with, if you just don't really eat beans or lentils at all, start with like a tablespoon a day, and after a week, do 2 tablespoons a day, work up like that. Your microbiome needs time to adapt to dealing with more fiber. Ultimately, it will be for the better, but go slow. Aim for at least 30 grams of fiber a day, but almost the more the better. Like 50 grams would be excellent. And then we have a formula called Smooth Passage that's a really nice option. Really, like as I was saying, variety is crucial. And so more different types of fiber is going to be really helpful. Smooth Passage is a mix of psyllium husk, ground flaxseed, and then 3 or 4 different herbs that are soothing and healing to the gut lining. So it's a really nice formula. And actually, I'm gonna post in the chat. There's a couple products I'll mention today that are just the things that we frequently use and find to be effective. And so you can take a look if you're curious. Okay. There. Okay, great. Um, and then increasing the plant polyphenols or antioxidants. There's really good evidence that increasing antioxidants in the diet is very helpful for allergies and asthma, likely eczema as well. Um, and some of the best ways to do that are choosing foods that are particularly bright in color. And so that obviously is the fruits and the veggies, but it's also like swapping out or sometimes at least choosing black rice or red rice instead of brown rice, choosing black beans or red beans instead of pinto beans. Not like you have to do that every single time, but in general, those foods are higher in antioxidants. And then same with the herbs and the spices and the herbal teas, those all, and green tea, black tea, all of it. Those all add antioxidants as well. So there's a major component of leaky gut or intestinal permeability that plays a role in all three of these conditions. So what's happening here is in a healthy state, the inner lining of the intestines is um, this single uninterrupted sheet of cells that are all very tightly linked, like quilted together, essentially. That forms a smooth barrier between the contents of your intestines, which are still technically outside of your body, and then the true interior of your body, which is like the bloodstream and the muscles and the organs. It has a gatekeeper effect. So foods need to be fully digested before they're allowed across that barrier into the bloodstream. And in a healthy state, nothing is getting into the bloodstream that hasn't been processed down to its component parts. Um, and bacteria and little pieces of bacteria are not allowed into the bloodstream. In intestinal permeability, the spaces between those cells in that sheet, protective inner lining sheet of the gut, get irritated and inflamed and kind of open up a little bit. So there start to be gaps, and then, bits of partially broken down food, bits of bacteria can now leak into the bloodstream where the immune system gets very upset about it because they're not supposed to be there. And it looks like invaders to our immune system. And so we respond by increasing inflammation and sending out, more immune cells to help deal with the infection, which is not truly an infection, but that's how the response goes. So we really want to focus on that and heal leaky gut as a part of recovering from chronic allergies or allergic conditions. And that is a bigger topic than we can get into today. We do teach another class on healing leaky gut. And so I am going to send out an email to everyone who signed up for the class afterward. Um, I'll try for tomorrow, but it's just when I can get the recording and emails from Monica. Um, and so I will send out a link to the class that we have taught in the past on how to heal leaky gut. So if you're curious to learn more, take a look at that. The general concept is discovering if you have particular foods that you react to and avoiding those foods, at least for a number of months. Also avoiding highly processed foods, chemical-laden foods, during that time, supporting optimal digestion, really helping your body to digest foods completely, which doesn't always happen. And then using herbs and nutrients to heal the gut lining and to support the microbiome with both diet and probiotics. And it can be really useful to, if people have more complex health issues going on, do some testing for gut infections, or we can do food intolerance testing at our office, at my clinic, in order to discover if you have foods that you're reactive to, if you don't already know. So, yes, I will send along the link to that class that goes into much greater detail. And then we want to balance out immune function. So, um, on a very simplified level, our immune system is a bit like a teeter-totter that can tip um, one of two ways. There's a lot more to it than that, but for our purposes, it's a useful metaphor. So when tipped one way, uh, and that option is called Th1 or Th1 immune response, the body is in the mode of fighting bacterial or viral infections. So it's a useful thing to be able to do that. Like we need to be able to do that. We just need to be able to turn it off when we're done. When tipped in the other direction of the teeter-totter, the body then can produce allergic responses and or fight off parasites. So, super interesting thing is that the actual kind of original goal of allergic responses and histamine production, which is what makes us like itchy and sneezing and runny nose and all of that is designed to kill parasites. So that's why it exists in our systems. It's not meant to, we're not meant to have allergies. Um, and yeah, so that's the original goal, and it is, all thrown out of whack by all of these environmental factors that we've been talking about. So that's the other side of the teeter-totter. That's called a Th2 immune response. Um, so we can, go allergy, viral infection fighting, or sorry, bacterial viral infection fighting, or allergy parasite fighting. The third option is to stay balanced in the middle. That's called a Treg or T regulatory response, and that is about maintaining tolerance, not fighting anything, just being in sort of a balanced state. So there are all sorts of factors, many of the things we've talked about that decrease the regulatory T cell activity, that balanced state of the immune system, and essentially make it so we get stuck either one direction or the other in the teeter-totter. So I'm going to go over top 10 things to help strengthen or increase a Treg immune response. Number one, sun exposure. This doesn't mean getting sunburned, but it does mean getting about 20 minutes of sun without sunscreen on. So it actually is, we get all sorts of benefits from sun beyond vitamin D, and wearing sunscreen inhibits many of them. So what I recommend is setting a timer for 20 minutes and getting your 20 minutes of uninterrupted sun exposure and then putting on your sunscreen. Obviously, getting sunburned is very bad and increases skin cancer risk. Number two, vigorous exercise. Not overtraining to the point of exhaustion or injury. And so this is going to be really individualized to each person. But getting your heart rate up, like moving vigorously, helps with a T regulatory response. Loving relationships and community. Cannot overstate that one. It's one of the biggest factors um, preventing heart disease, and in this case as well, balanced immune responses. So cultivating community is so, so important. Having a healthy circadian rhythm is number four. So that means, as to the best of our ability, sticking to a regular bedtime and a regular wake time. So if you're constantly breaking the rhythm by going to bed and getting up at wildly different times, that really disrupts the immune system and decreases T regulatory activity. Probiotics is number five. So at least 10 billion CFU or colony forming units. For kids, at least 5 billion. And, especially for babies and small children, you want to choose really reputable companies and also formulas that are meant for children and babies because the microbiome has different dominant strains in a small child compared to an adult. Um, the formulas that we carry that are more for adults are called Temple Biotic, um, Smidge or sensitive probiotic is a low histamine strain. So probiotics can actually be somewhat high in histamine. That's fine for most people, but some people with like mast cell activation syndrome, some more complex allergic conditions can be really sensitive to histamine and might be bothered by certain probiotics. So the Smidge probiotic can be helpful there. And then there's a third one called Immunospore. It's a spore-forming probiotic and works in a very different way, but also can be useful. Number 6, fish oil. So getting 1,000 to 3,000 milligrams of combined EPA and DHA daily can help with a balanced Treg response. Optimizing vitamin D. So this is separate from sun exposure, but related. Most people in this part of the world are deficient unless they supplement because for a lot of the year, the angle of the sun through the atmosphere is so low that we just can't get enough vitamin D, even if we are outside all day. And then, the clouds and the rain get in the way as well. Um, if you're not sure, it really is useful to get tested. I have some people who just don't absorb it well and, maybe take really like 10,000 IU a day and can't get their levels up high enough. And then other people where 10,000 IU a day would be too much and they're getting their blood levels are too high. And that really is not a good thing. We want to be in a mid-range. It's safe for most adults to take, say, like 3,000 to 5,000 IU daily. It should be taken with a meal to improve absorption. And then it's safe for most kids over age 5 to take 2,000 IU daily. Lower doses of 1,000 to 2,000 IU in adults are often not enough to raise blood levels. Number 8 for T regulatory activity is turmeric. So you can drink golden milk daily, or we have a turmeric or curcumin, which is one of the powerfully anti-inflammatory constituents in turmeric supplement called Theracurmin HP, or high potency. And that's in the product collection. Number 9 is antioxidants from our food. So kind of coming back around to this one, eating fruits and vegetables that cover a wide range of different colors every day. And then the herbal teas, all of those things. So this is yet another reason why that's really beneficial. And then number 10 is NAC, which is it's a little string of 3 amino acids. It acts as an antioxidant. It acts as a precursor to your body making glutathione, which is one of our most powerful antioxidants that our bodies make and need in order to protect the liver and lungs and brain. And it's really helpful for reducing reactivity in allergies and asthma. So at least a starting dose would be 600 milligrams once a day. It can be used in much higher doses sometimes, but that would be, with consultation with your healthcare provider. Let's see, I think I've got a question. Oh, suggestion for turmeric for kids. That's a good question. There are liquid formulas. I am not sure if we still have it, but there's one called liposomal curcumin and resveratrol that is a liquid form that tastes pretty innocuous. So a small dose of that could be added to juice or something like that. So yeah, I would look for maybe a liquid formula. And you could slip a little bit into smoothies or baked goods of just the powder as well. All right. So getting back to environmental toxicity, as we talked about earlier in class, there's an aspect of these conditions that is caused by exposure to toxicants in the environment. Um, so, a really important aspect of addressing these conditions is helping the body rid itself of accumulated toxins through gentle cleansing, and then most especially reducing exposure to toxicants. So, if you're doing cleansing but not paying any attention to reducing exposure, then you're just kind of going round and round and, adding more toxicants as fast as your body can try to get rid of them. So, um, first steps for reducing exposure would be avoiding processed foods and refined sugar, eating organic as much as possible. Um, Going through the products in your home and swapping them out for safer alternatives. So the co-op does a good job of stocking, many of the kind of simplest, cleanest body care, skincare, cleaning products. So they are a wonderful resource. I use an online resource called skindeep.org to look up products that I'm curious about. So that is a really, really good resource if you're kind of looking at your shampoo or your lotion and you're wondering. You can look it up in there. And I try to have people aim for, so it rates thousands and thousands, tens of thousands of different body care, skincare products as far as their toxicity. I recommend aiming for a rating of 3 or below, but also looking at what are the things that are in it, because sometimes it'll just have one really bad uh, thing, but then the average will be low for the rating. For example, a lot of products have fragrance, or it's called parfum sometimes. And that is this unregulated category is just sort of a cocktail of random chemicals that they don't have to disclose. And so it can be really, really toxic, full of phthalates, full of endocrine disruptors, full of allergenic ingredients, and you just have no idea. So I generally recommend avoiding products that say fragrance or parfum in the label. And then avoiding plastics as much as possible, especially for our water bottles and food storage, choosing glass and stainless steel, and then especially not heating food or drinks in plastic containers. Um, Even those disposable coffee cups, they look like they're paper, but they're lined with plastic and release a ton of microplastics into your drink. So bringing your glass or stainless steel reusable cup to your favorite coffee place as much as possible. And then, as able, investing in a good quality water purifier and air purifier. Um, One of the handouts I'll send out in the follow-up email is um, a handout that I created for another class I teach called Introduction to Cleansing, and it's kind of goes over some of these. I think it's called the top 6 ways to stop retoxing, and lists some of my favorite air purifier and water purifier brands. We have an Austin air purifier in each of our treatment rooms at Tummy Temple, and those are fantastic. They last a really, really long time. You only have to replace the um, carbon block filter like once every 5 or more years. Um, so they're an investment, but they work great and really help reduce allergies. And then finally, it's really helpful to ask yourself, are all of my organ systems eliminating properly? So the organs of elimination are the body systems that allow us to process and eliminate waste, and they include the colon through our stool, the kidneys through urination, the lymphatic system, our skin through sweating, and then our lungs and even our emotions, just processing and sort of detoxing emotions. Um, so questions to ask yourself are, am I sweating regularly through either sauna or exercise? Am I pooping at least once a day, but ideally 2 or 3 times a day? Am I moving my body every day? Am I staying hydrated? Am I feeling and processing and releasing my emotions? And if one or more of those areas you are not doing those things, then that would be a really important area for you to address. So, drinking approximately half your body weight in ounces. So if someone who weighs 150 pounds would aim for about 75 ounces of water. There's an upper limit though, no more than a gallon per day. And then, you would probably need a bit more than that recommended allotment if you are exercising and sweating profusely, or if you're drinking a lot of coffee or something like that. And then getting enough dietary fiber to help you poop, aiming for at least 30 grams of fiber a day, but slowly working up to that. And then magnesium citrate is a great tool to kind of help keep things moving along regularly in the bowels. The product we manufacture is called Temple Calm, and it's just a simple magnesium citrate powder. So in that one, 250 milligrams to 500 milligrams a day, or 1 to 2 times a day for most people. And then sweating at least a couple of times per week through either exercise or sauna. And moving your body regularly. And so that helps move the lymphatic system. So through exercise, through massage, through dry skin brushing, and then castor oil packs are another treatment that really helps. And then for the most part, for most people, I recommend a gentle cleanse 1 to 4 times a year. It's not recommended to do cleansing if you're pregnant or breastfeeding, nor for small children. We use a system called, it's Quicksilver Scientific. It's a really wonderful company called the Push Catch system um, that has a formula that helps push toxins out of your system, and then a binder that helps catch them so they don't reabsorb and recirculate. So that's an option. And then we also offer colonics, electrolymphatic therapy as really wonderful supportive therapies to help keep your body um, uh, cleansing properly. And I teach that class usually yearly called Introduction to Cleansing, so keep an eye out for that as well. We go into much more detail. So I'm going to go into a bit more kind of individual pointers for each of the different conditions. So for allergies, for eczema, and for asthma. And they're just starting points to begin healing. They're most effective if used in addition to the root causes that we've already discussed. So for allergies, doing a neti rinse, or you can also get a squeeze bottle called a Neilmed that sometimes is a little bit easier for people to use, and rinse out your nasal passages and sinuses 1 to 2 times a day during the season that you get a lot of symptoms. You definitely want to use distilled water for that. Nettle tea can be really helpful. So you'd steep a tablespoon per 8 ounces of hot water for 10 minutes and then drink that, and drink 2 or 3 cups per day. We have a really great formula called Natural Dehyst that is a combination of a bunch of natural antihistamine substances, quercetin, NAC, bromelain, nettles. And so that's a wonderful formula, and would be like during heavy allergy season would be 2 caps 3 times a day for, maybe a loading dose for a week or two, and then 2 caps twice a day ongoing until the end of allergy season. And then we have an herbal formula called Tree Country, Allergy and Sinus. And that has really good dosing instructions on the bottle. But the combination of the dehyst works a bit slower. So it kind of takes like a week or so to get the levels up in your body and have it start working. The Tree Country is more like in the moment allergy relief. And then vitamin C, 1,000 milligrams a day, can be helpful as well. Vitamin C has antihistamine functions. And then um, an approach that I've done training in more recently is called sublingual immunotherapy. And that is in some ways similar to in the conventional world, you can go in and get allergy shots. This is works just as well or better without the shots. So I can order allergy testing that actually is, not looking for food intolerances, but truly looking for, you know, allergies to the local trees, pollens, weeds, etc. So to find out, and as well as pets, animal dander, dust. So you can do a blood test rather than the skin prick testing. And so that's a lot more tolerable. It's not, nobody really likes getting jabbed a whole bunch of times with things that they might be allergic to. So this is just a blood draw, and they test your blood for antibodies to the different allergens. And then the treatment is, a customized plan of a lot of things we've talked about today, plus very dilute drops of the things that you are allergic to help kind of re-educate your immune system and get it to respond in more of a tolerance manner to those conditions. And it works really well. It's a wonderful treatment approach. So that would be, schedule a ND consult if you want to try that. For eczema, basic things that can help are liver support. So we use a formula called HEPA caps, and that would be probably 2 caps twice a day ongoing. And then consider doing the push catch program or something similar for cleanse support. Probiotics are really helpful, so the temple biotic would be a good option. L-glutamine is a amino acid that helps heal the gut lining. So that would be a teaspoon or 5 grams 1 to 2 times a day. And it doesn't taste like much. You can mix it in a little water, or it just kind of disappears into a smoothie. And then fish oil is really helpful in eczema. And as well as vitamin C and zinc improve skin healing. For asthma, really increasing antioxidants in the diet is so, so helpful for this. For a lot of people, removing dairy is really helpful. NAC that we talked about before, we usually want to do a higher dose in asthma. So a lot of times people benefit from potentially working up to 2 capsules. Working up to 1,800 milligrams a day. So 1 capsule 3 times a day. And at higher doses, NAC also thins out mucus. So it has this additional benefit. We have a formula called Deep Lung by Wish Garden Herbs, and that dosing can be modulated based on symptoms, but that can really help in asthma, and then vitamin C as well. Just want to, touch on especially asthma and sometimes allergies can have a risky side that can be dangerous. So you definitely want to be working with your doctor. With asthma, you want to absolutely have an inhaler and keep it with you, even if you don't need it often. With any history of anaphylactic type reactions or progressively getting worse reactions, make sure you have an EpiPen and have one in your car, have one in your purse or your bag. Keep it with you at all times. It's just not worth the risk to not have that. And then with asthma, sometimes people really want to get off their medications. Don't just yank them. Add in these root cause approaches first and then work with your doctor to see if you are able to reduce them over time, but don't make it a sudden thing. All right, so I am about finished. We do offer a discount if you'd like to try any of the products that we talked about, and I'll include that in the follow-up email. That'll be good for a week, and it'll be good for 20% off any of the things in our online store except for gift certificates. And then if you'd like to try one of our uh, services, come in for a naturopathic consult or an electrolymphatic therapy treatment or a colonic, we're offering $20 off of a session as long as it's booked within the next week. It doesn't have to be for the next week, but you have to call to make the appointment within the next week, if that makes sense. So, love to see you in if you'd like to try one of these things. Um, but yes, I will send out a couple handouts that go over some of the things we talked about in class, just emphasizing the antioxidants, some of those things to reduce environmental exposures. Any more questions before we wrap up?
There was a question on the chat about turmeric for kids, and
I
I
I
apologize if you
answered that
addressed
one
that.
as we
Oh, I'm
went.
sorry. I'm
That's
sorry.
okay.
I
That's
must have
okay.
missed that.
All right. Anyone else? Just want to say thank you again for showing up and happy to have you here. I hope this was useful for you. And thank you again to Monica and to the Olympia Co-op for being such a wonderful resource for all of us and community hub. All right. Hope everybody has a good evening.
Thank you so much, Dr. Wood.
Of course,
Appreciate
my
it.
pleasure.
I learned a
Okay.
lot as always.
Great. And Monica, do you think you might be able to send me the email addresses and recording tomorrow?
I'll try. Yeah, I have another full day of work, but maybe I can get it done tonight. Get
Okay.
it loaded, and I'll get it to you as soon as I can.
Okay. Thank you. I'd
You
like to
bet.
send a follow-up email out by Monday at the latest, if possible.
Sounds good.
Okay. Thank you. Good
Uh-huh.
night.
Thank you. Good night.